Hi there and welcome to our channel. My name is Sarah and I'm here today with iHealthBrokers. Now at iHealthBrokers, we really are the Medicare experts, so if you have any questions whatsoever about your Medicare coverage or health insurance in general, please feel free to send us a message. You can reach us in the comments or give us a call at 888-918-0518. There's absolutely no charge for our services and we are, of course, licensed nationwide. Additionally, please do make sure to subscribe because we release these videos on a weekly basis. And as always, you probably know, but make sure to like this video. Liking this video will make it more visible to others who are looking for the same type of information. And if you're so inclined, you can find us on Facebook at iHealthBrokers, and of course here on YouTube at iHealthBrokers, on Twitter, TikTok, and Instagram. Now today we're going to be talking specifically about the Medicare special enrollment periods. There are many different types of Medicare, many different parts with different enrollment periods associated, and on top of that, there are different special enrollment periods that you may qualify for. So we're going to break it down in today's video. So first, let's discuss Original Medicare. Original Medicare is Medicare Part A, which is your hospital insurance, and Medicare Part B, which is your outpatient insurance. Traditionally, you'll become eligible for Original Medicare when you turn 65. And that enrollment period is a 7-month window, which is the 3 months before you turn 65, the month of your birthday, and the 3 months thereafter. However, you may qualify for a special enrollment period. The main way to qualify for a special enrollment period for Original Medicare is to continue with your employer-sponsored group health insurance past the age of 65. So if you're like one of many Americans who continues to work past the age of 65 and you maintain that creditable coverage through your employer, well, once you retire, once your health insurance through your employer ends, you'll enter into a special enrollment period. You'll have 8 months to enroll in Original Medicare without penalty. If you miss that special enrollment period or you're ineligible for a special enrollment period because you're not working and maintaining that coverage, then you may be subject to a late penalty. And of course, if you miss your original window, you're not eligible for a special enrollment period, then you'll have to wait for that general enrollment period, which is every year from January 1st to March 31st. But the longer you wait, the higher your late enrollment penalty will be. On a side note, you must maintain creditable coverage. COBRA is not considered creditable coverage, so please do not defer Medicare in favor of COBRA. You will be subject to a late penalty. Now, if your spouse receives their health insurance through your employer, but they're not yet eligible for Medicare because they haven't turned 65, your spouse can actually keep their coverage through COBRA even after you've enrolled in Medicare. So please make sure to check out our other video about deferring Medicare and when and why it might be right for you, but don't hang on to that COBRA coverage thinking that you won't have to pay a late penalty because you may be in line for an unpleasant surprise. Now let's talk about Medicare Advantage and Medicare Part D. So Medicare Advantage is also known as Medicare Part C, and it's an alternative route to Original Medicare. Basically, it will replace Original Medicare and very often offer you additional benefits. Then there's Medicare Part D, which is your prescription drug coverage. So again, the initial enrollment window is going to be the same as with Original Medicare. It's the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter. However, the special enrollment periods that you may or may not qualify for are a little bit different. The first type of qualifying life event has to do with relocating or moving. If you move to a new address, you may no longer be in your plan's serviceable area. Or if you move to a new address, you may still be in your plan's area, but there may be other plans available to you. Additionally, you may be eligible for a special enrollment period if you've just moved back to the country, or if you've been released from jail. Also, if you're receiving some type of long-term care in a skilled nursing facility, if you've either just moved into that skilled nursing facility or just been released from, then you may be eligible for a special enrollment period. If any of these apply to you and you do relocate, you'll have 2 full months to either join or switch plans. You may also be eligible for a special enrollment period if you lose the coverage that you currently have. Now, this could be your employer-sponsored group health insurance, or it could be Medicaid. Again, you'll have 2 full months to enroll in a new type of Medicare Advantage plan. It could also be something that happens on your health insurance's side. For example, Medicare might sanction your plan if they're not living up to their terms, or it might terminate their contract entirely. Now, if it sanctions the plan, basically this is on a case-by-case basis, so make sure to follow up. And if it terminates their contract entirely, then you'll have 1 month to find and join a new Medicare Advantage plan. There are also many other special situations which may qualify you for a special enrollment period. If you become eligible for Medicare and Medicaid, then you'll be eligible for what's known as a DSNP, which is a dual special needs plan. At that point, you'll be eligible for a special enrollment period. Also, if you qualify for the Extra Help program, which will help you pay for Medicare Part D, then you'll have a special enrollment period. If you're diagnosed with certain types of severe disabling conditions that fall under C-SNPs, which are chronic special needs plans, then you may be eligible for a special enrollment period. Make sure to check out our video all about C-SNPs if you want to learn more about that. Also, you are able to leave Medicare Advantage plans under additional circumstances. Now, these aren't really special enrollment periods, but I just want to mention them anyway. When you first enroll in a Medicare Advantage plan, you'll have 1 year of basically a trial of Medicare Advantage, during which you can leave and disenroll at any time. And also, there's the Medicare Advantage open enrollment period, which basically allows you to switch or drop your Medicare Advantage plan. You just can't sign up for Medicare Advantage if you're not currently enrolled in it. We've got videos that go further into detail, and I will put those in the description below. For Medicare supplement plans, also known as Medigap plans, there actually is no specific enrollment period or special enrollment period necessary. You can enroll whenever you want, year-round. However, it behooves you to do so during your individual open enrollment period, which is the initial period, the 6 months after you turn 65, and enroll in Medicare Part B. During this time, you won't be subject to medical underwriting, which means you pretty much have your choice of any Medicare supplement plan available. There won't be medical underwriting, which means you can't be charged more or denied. The key here is not only that you're 65, but also that you've signed up for Medicare Part B. So if you've deferred Medicare Part B, that means you'll have a little bit extra grace period to enroll in that Medigap plan. If you enroll outside of that initial enrollment period, then you may be subject to medical underwriting, which means you could be charged more or denied outright. If you like this video, and I hope you did, please make sure to give us a thumbs up and of course subscribe as well, because we do release these videos on a weekly basis about not only Medicare, but updates to health insurance and healthcare in general. And of course, please make sure to find us on Facebook, Instagram, TikTok, and Twitter. Now, if you have any questions, comments, if there's something that you feel like we've left out of this video or a video that you'd like to see, please let us know in the comments below. And of course, you can always call us at iHealthBrokers at 888-410-0344. There is absolutely no charge for our services, and we are more than happy to help. Thank you so much and have a wonderful day. Bye-bye.